Welcome to Green Time. I'm host Don Fitz. This episode we're going to be talking about cutthroat capitalism, healthcare in the U.S. I have a couple of registered nurses who have thought a lot about this issue with me tonight. There is Mimi Signor with Missourians for Single Payer, and we have Jan Rodolfo with National Nurses United. Mimi, thanks for being on Green Time again.
Thanks for having us.
And Jan, thanks for, this is your first episode with Green Time, and thanks so much for coming.
Thanks for having me.
Great. So tell me some about the history of where we're at now. Do we really have a problem with private insurance companies dominating the healthcare scene?
I think that it's pretty obvious. In July of 2015, we started seeing the monopolies buy each other up. So Aetna's buying Humana, Anthem is buying Cigna, and Centene is buying HealthNet. These are huge monopolies to begin, but now they're going to end up being the big three or part of the big four, and they're going to dominate. This is bad news for hospitals and doctors because insurance companies are going to dictate lower payouts for care, and they're going to be stuck with less reimbursement than they are accustomed to getting, and they'll have to cut costs in some way in order to make up for these low reimbursements.
Well, you've got this industry that has no reason to exist, right? They take
the health insurance company.
Absolutely. I mean, they exist to be a middleman that doesn't actually provide any care, right? So they collect money and make a profit off of providing less care than the money collected, right? And that's the business model. And so
right. If you disperse $1 billion worth of care, you want to take in 1.2 billion or 1.3 billion. That's $200 or $300 million that just goes into the insurance company.
So when they pay for care for you or I, if we're insured, they think of that as a loss, right? So they do everything that they can to avoid that. But they also take a bunch of money off the top, right? So if they're a monopoly, it means that they're going to have more leverage to negotiate prices, right? And additionally, they're tied into the political system, right? It's self-reinforcing. So the insurance companies have so much money that they spend on lobbying. As a result, lobbyists work to give the insurance company additional consolidation in power and regulations, right? And so it loops back and forth.
People hate insurance companies because they have to deal with denials and reading the fine print of what's covered, what's not covered, what they owe, which is normally a lot of money. And yet Wall Street loves health insurance companies because they have outperformed the Fortune 500 well over the S&P 500 since 2010, which was when Obamacare was rolled out. And in addition to that, they pay their CEOs scores of millions per year. In 2014, one of the highest paid CEOs made $66 million just in
66 million is amazing for years.
And also Centene, which is based in St. Louis, that CEO made about $14 million in 2014, and plus his bonuses and perks. And as Jan was saying, these are just middlemen who come between you and your healthcare providers.
So when we get a healthcare bill, and that bill might be $500 or $1,000 or $5,000,
that would be cheap.
Cheap. So a portion of that money that we're paying for our bill actually goes to paying the insurance company to lobby so that they can exist.
And to market, yeah.
And so that's a lot of what we're paying for. I know that a friend once told me who did repair work in my house, he said, every time that you pay one of those big home repair companies, you're paying for their advertisements on TV. That's what you're paying for with your bill. And so whenever you pay your hospital bill or your health care bill, that a portion of what you pay actually goes to everything, like the huge CEO salaries of 13 million to 60 million, and it goes to paying for the healthcare insurance industry to lobby in Congress on their own behalf.
And this is the way of industry. They have a fiduciary responsibility to their stockholders. So Wall Street just loves the insurance companies because there's no way they're going to make less money for their stockholders, because if they don't think they're making enough money, they just raise the premiums. It's very easy to do. It's predicted for 2016 that premiums will go up by 20 to 40%.
Let me ask you this. Is this what we expected when Barack Obama was elected president in 2008? That he would present Obamacare, which would give a monopoly to a small number of insurance companies?
I think that many people had high hopes that Barack Obama would support a single-payer Medicare for all style of health program for the United States. He stated many times while he was a candidate that he was for it.
This is in 2008. He said that he was for it.
Before he was elected,
yes.
He said he was for it. He spoke in front of the AFL-CIO and told them that, he was for it. He said, we have to take back the White House, we have to take back the Senate, we have to take back the House of Representatives. But in fact, what he meant was we have to take it back from the lobbyists, and we haven't done that. We've moved to the other realm of what lobbyists can and can't do, and their influence is more, not less, than it was before.
Okay, now tell me this. What is the whole concept of individual mandate mean for what we got under Obamacare?
Well, the insurance companies, they had to offer something in exchange for something. So what they gave was that if insurance was mandated, in other words, if people had to buy commercial insurance, then they would say, we'll take out the pre-existing conditions. So if you have heart disease, you can still buy insurance. So that was the bargaining. And in exchange for that, U.S. citizens are required to purchase insurance.
Well, that was an actual positive part of Obamacare, because there were a lot of people who had pre-existing conditions that weren't just weren't covered prior to Obamacare.
There's no doubt, but that's a positive aspect. But we got to remember that having access to health insurance doesn't mean you have access to health care, right? So. And the exchanges under Obamacare, which you could buy an exchange plan in order to fulfill the individual mandate requirement. If you're on the lower tiers of that plan, the deductibles are so high that for all practical purposes you're uninsured. Right?
If you have a pre-existing condition?
Regardless of the pre-existing condition, the lower cost plans, which many people are forced to purchase in order to avoid a tax hit on the individual mandate. Are essentially catastrophic plans. They're not designed to, for day-to-day health care.
Okay, so that lower cost plans will help you if you have something which costs $100,000, but if you have run-of-the-mill problems costing $2,000 to $20,000, you're going to end up paying just a huge amount for that deductible.
Right, and that's why we see patients delay care and come to the ER when they're very sick and having not received preventative care. That's an artifact of this country and this country's healthcare system, that people think about money first at the moment that they're feeling sick.
Yes, and I find that I think one of the most important issues about the claim that giving more health care costs more when it actually might cost less. Because if you get the health care before the condition becomes severe, then the overall health care bill might be a lot less.
Right. Well, there's no question that the countries around the world, most industrialized countries and Western countries provide health care for everyone and do it at much lower cost per person than we do. And we have so many uninsured and so many people underinsured.
What is it,
also.
the United States is something like 30 or 40% more than most European countries in terms of the cost of health care per person?
I think that our per capita cost for our public health care, which would be Medicare, Medicaid, public employees, et cetera, is about $6,000 per person. And that is much more than any other country, all of whom cover everybody, and we just cover a fraction with our public health. So it's really exorbitant, and we're not getting what we're paying for, not at all.
Okay. Well, let's take a break, and we're going to look at, we're going to hear a song about Medicare for All, and then we're going to come back and talk about what an alternative plan would be if we had a Medicare program that covered everybody. We'll be back in just a minute.
Now's the time to finally realize we the people must make some choices. If we want single-payer health care, now's the time to raise our voices till they hear us in the halls of government and behind each corporate door. That we're sick and tired of getting less and less while paying more and more. Put people before profit. Join with many doctors, nurses, and other concerned Americans in support of America's best and most affordable health care plan. Single-payer, improved Medicare for all. Let them hear us. Medicare for all, because healthcare is a right. Medicare for all, and the U.S. saw the light. That the best healthcare plan is a single-payer plan. Now's the time to finally put it on the table. Contact your legislators and tell them to save Medicare as we know it and expand it into Medicare as we need it. Improved Medicare for all, because your interests are special too. Let them hear us. Medicare for all, because healthcare is a right. Medicare for all, and the U.S. saw the light. That every woman, child, and man should have healthcare in this land. Now's the time to finally put it on the table. Contact your legislators and neighbors and tell them to support healthcare for all, because healthcare is a right, and our interests are special too.
Welcome back to Green Time. I'm host Don Fitz. We're talking about cutthroat capitalism, healthcare in the U.S. And with me, I have Jan Rodolfo with National Nurses United. Do I have that correct?
Got that right.
Fantastic. And I also have Mimi Signor with Missourians for Single Payer. And both of my guests are registered nurses. And so we're going to go, we just heard a song about a single payer program. Now, is that really a better program? Would that really be better than Obamacare, what we got in 2010?
Well, what we're talking about in a single-payer program is really a universal single-payer program. So it simply means one fund, one program, and one payer. And the one program would be everybody in, nobody out. So birth to death,
so
you're in
gets
the
covered.
program. Exactly.
Mm-hmm.
And then what Jan and I had discussed earlier was that this plan would have the very highest quality of care possible. And we have enough money in healthcare to actually deliver that. And we also have enough hospitals, we have enough doctors to deliver the care. It's actually more expensive to have CAT scanners and MRIs in hospitals and do 1 or 2 patients a day because they have insurance and nobody else can afford that. It's really much cheaper to have the technology and use it than have the technology and not use it.
Oh, because is that because if you use the technology, you can actually find out who has a more serious condition that needs to be treated now?
Well, I mean, if your insurance entitles you to an MRI, but everybody else's doesn't, then you're underutilizing that MRI. So you have to charge more for that MRI because you're only using it, say, once. So our problem in this country is not overutilization of care, which is what the insurance companies would like you to believe. It's underutilization. We just can't get it because we can't afford it. So it would be, higher quality. It would be a universal access, and it would be comprehensive. So it would cover, everything you would need, including dental, which is so important. I just can't believe we put dental care in a different category
that
than
is very
healthcare.
odd. Yeah. It looked like it was going in the opposite direction for a few years. I can remember about 30 years ago when there were HMOs, that I went to an HMO, a health maintenance organization, and the dental clinic was in the same clinic. But that seemed to exist for a very few years, and then they split apart again.
Right. In addition to comprehensive coverage, the other thing people need to really envision for themselves is being able to see any doctor, any provider,
I wanted
any
to ask
hospital.
about that as choice. Is that in a Medicare system, would you be assigned to a doctor, or could you see?
No, the way the Medicare for All bill is written, you have free choice of provider, and you can go to anyone, which, what we have now is more ACA, accountable care organizations and managed care organizations, and they do limit where you can go and who you can see. So this would change that completely.
Okay, so now if somebody has a particular insurance company, you can only go to certain providers for that?
In many cases, yes. Okay. There are, different levels of insurance, and so if you pay more, you have more choices. But if you can't afford to pay those very high premiums, then you have to pick from a list.
And often a doctor that is in your network this year is not in your network next year, and so you lose that continuity of care with your physician, that relationship.
That happened to me one time with hernia surgery. I made the mistake of making an appointment for hernia surgery when in December. And then the state of Missouri changed the healthcare providers, and I called up for my surgery, and they said, "Oh, well, we can't cover it," because it was January. The healthcare provider isn't there. We don't have a contract with them anymore.
Well, that's a big problem because health insurance companies don't have to play by any rules. They can change your list of providers. They can change your medicine list. They can change anything. But you cannot change anything until it's enrollment time again, and then January 1st you can...
That is so bizarre to have the enrollment time, and you have to choose between this plan and that plan and another plan. Right. If you try to explain that to people in another country, that this is the way American healthcare works, in virtually any other country, people look at you like you're crazy, like you have to be making that up. You couldn't possibly have a healthcare system that complicated that focuses on denying people health care.
Well, pharmaceutical companies are opposed to a Medicare for All system as well, because then if you have one payer, Medicare, they could negotiate drug prices. And when you just have one entity to negotiate with, then they have all the power.
And I've been confused when the debate first happened. I know that I was confused by single payer, the phrase single payer, because that implies, you're talking about monopolies before, that sort of implies that you get your monopolies down to one big monopoly, and that's the monopoly. But what we
in negotiating prices, it's a good thing.
You mean if the Medicare system were to be the single body negotiating prices? They would be able to go to different pharmacy companies and pharmaceutical companies and negotiate the price of drugs down a lot more.
Right. Yes, but as also reimbursement to doctors and hospitals. Right now, Medicare negotiates those reimbursement rates, and then health insurance companies may pay a little more, they may pay a little less, but they're using Medicare payments as a guideline, and then they can go up or down on their reimbursement. But they're going down on reimbursements in a big way. And, there is a big move to change Medicare, to destroy Medicare, or to phase it out already with Obamacare. The government has taken money out of the Medicare trust fund and using that money to pay for tax refunds for premium assistance under Obamacare. So we're losing money out of our trust fund, and it will destroy Medicare as we know it if we don't fight for it.
Oh, absolutely.
So 2015 is the 50th anniversary of Medicare.
Okay.
Okay, and Medicare is a wildly successful, popular program that has the free choice already that we talked about, right? That operates as a single payer for the community that is eligible, the 65 and older and disabled community already plays that role, right? We think it needs to be expanded to cover more comprehensive care, right? To take care of some of the things that have been sort of chipped away over time. And we think everybody needs to be covered cradle to the grave. But it's a deeply American program already. It's something that works, is tested, but that the private insurance companies are coming in and trying to kind of take a share of, as Mimi was saying, with these private Medicare plans that are pushing their way in, really taking public funds away.
Now, one thing that you mentioned several times, both of you, is that there would be choice of providers.
Right.
But I wanted to point out that is limited in the sense that if the place that you go, if somebody says, well, I really like my doctor, you should get my doctor, and the doctor is full, well then you don't have that choice. So your choice of providers is only to the extent that the provider is open.
Sure.
Okay, so, and that happens for a lot of people. They can't get a particular doctor they would like to.
Right.
But you would not be dictated by industry that you would have to go to a particular, that you couldn't have this company, or you couldn't have this physician who would be taking care of you.
Well, we have that now where there's a very popular physician and everybody wants
right, and so
that person to
Medicare
deliver
for
their
all,
baby or something
Medicare
like
for all
that.
wouldn't change that. It wouldn't make it worse. It would just it just wouldn't mean that you could actually choose whoever you wanted to go to.
Exactly. You couldn't see that many patients in a day, 100 patients a day.
Okay.
I think it would actually improve the care that each provider provides, because insurance companies are really driving shorter appointments, less quality time between providers and patients.
Yes.
And so imagine your provider who's being able to actually spend a little bit more time with you and building that relationship.
We're going to need to take a break, and we will be back in just a few minutes to wrap up the discussion of healthcare in America. Welcome to the final part of Green Time on Cutthroat Capitalism, Healthcare in the U.S. Jen Rodolfo, you are with National Nurses United. Now tell me, what would you like to leave the viewers with in thinking about a good healthcare system? Okay,
I want to talk for a second about what motivates me, what puts fire in my belly about fighting for better healthcare. I took care of cancer patients for 10 years at the bedside, and I did it on the PM shift. So I took people in for bed, their families headed home, and every cancer patient that I had, invariably, who was under 65, wasn't Medicare eligible, invariably broke down and had a conversation with me about the fact that they weren't sure if their families were better off with them alive or whether their families would be better off if they passed. Families don't realize that conversation happens, but that is a cancer patient. They talk about it, and in other countries it wouldn't come up at all. You would focus on taking care of your cancer and getting treated. In this country, people worry about bankrupting their whole family.
Yes, because cancer is incredibly expensive.
Right, and so that just moves me to action around this issue.
We are the only country that has such thing as medical bankruptcies. You know, healthcare doesn't bankrupt people anywhere else. And we are fighting for healthcare crumbs because the economy is bad and the very rich is doing very well and the rest of us are struggling. So we're fighting over healthcare and saying, I deserve it more than you do. You smoke, you're too fat, you're too old. But what we need to focus on is that everybody deserves health care, everybody needs it, everybody should have it.
Mimi Signor and Jan Rodolfo, I want to thank both of you for being on Green Time. I want to thank our viewers for tuning in, and I want to urge you to tune in same time next week.